Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Today, we will be studying about a very small and interesting topic, that is the topic of fibrosing disease. Okay, now you can be asked this topic as a very short note or it can be asked as an MCQ. Okay, so you have to study this topic from that perspective. Let's study. So, fibrosing disease are basically a group of disorder characterized by excessive deposition. Excessive deposition. Deposition of what? Deposition of extracellular matrix, which leads to the formation of scar and tissue stiffness. See, if I give you an example, like if in your home there is a repair work going on in your homes and the carpenter tries to put some extra cement over there, what it will do is all the walls will be similar, but the area in which that carpenter has put the extra cement, it will show, right? So that is why whenever there is extra accumulation of tissues, there will be the formation of scar and you will be able to appreciate that scar. Like on my right hand side, you will be able to see a mole. I know it's not visible, it's not prominent, but it is due to the scar formation that has happened to me during any of the injury. Okay, so that is basically due to the extracellular accumulation. What is the pathogenesis? See, pathogenesis is obviously there should be a injury. So there is a injury. After the injury, what happens? The chronic tissue damages. The chronic tissue damages. And after that, they will recruit the inflammatory cells. They will recruit the inflammatory cells. After that, what happens? There will be cytokine release. As a result of which, what will happen? There will be TGF-β that will lead to the central mediation. Okay. After that, this is the injury, like there has been occurred an injury. After the injury, what will happen? There will be the release of the inflammatory markers, and after the release of inflammatory marker, the cytokines level will increase. Next you have is the fibroblast activation. After the mediation, there is fibroblast activation. In this, you have the inflammatory mediators, and basically the fibroblast differentiates into the myofibroblast. Okay, then what will happen? Why the stiffness is coming? It is due to the excessive production of collagen type 1 and 3 deposition, because this collagen increases. And you know guys what, many a times you are not able to differentiate between the cartilage type 1 and type 2. Okay, so remember 1, how you write 1? 1 like this, write bone. Bone is having 1. Type 2 is having cartilage. Okay, not the cartilage I was trying to write. I was trying to write collagen over here. Collagen type 1 and type 2. So type 1 is bone and type 2 is cartilage. Okay. So what are the causes and association? You have firstly the lung. In the lung you have the idiopathic pulmonary fibrosis, pneumoconiosis and post-TB fibrosis. We will read about this. In the liver you have cirrhosis, and cirrhosis is mainly due to the excessive intake of alcohol. Like alcohol is the leading cause of cirrhosis. Okay. In the kidneys you have the diabetic nephropathy. Okay. And you also have the chronic glomerulonephritis. In the heart you have the constructive pericarditis and the endomyocardial fibrosis. In the skin you have the keloids and you have the hypertrophic scar. And you know what? The keloids and hypertrophic scars are a very famous question of your wounds. they will ask you that what is the differentiating features between keloids and hypertrophic scar. What is the most common location? So most common location of keloids is mainly the chest. Okay. Now you have the systemic fibrosing disorders. In that, you need to remember that there is systemic sclerosis called as the scleroderma. We have read about scleroderma as well, right? So it is an autoimmune connective disease with widespread fibrosis. It is also associated with fibrosis. Then second you have is the nephrogenic systemic fibrosis. It is associated with gadolinium and the renal failure. Okay. What are the clinical features you will be able to see? Now, we have seen that different systems are involving. Okay, so different system will show the different clinical features. Obviously, in the lungs, you will be able to appreciate that the patient will have dry cough, progressive dyspnea, clubbing. I have told you how you have to see clubbing. You have to ask the patient to do both the thumbs like this. And if there is a space in between both the thumbs, this means that clubbing is not there. And clubbing is most commonly seen in the people who are chronic smokers. Okay. Next, you have is the liver fibrosis. In that, you have the jaundice, ascites, variceal bleeding, and hepatomegaly. Okay, we will read about this in our GIT section as well. Then you have the renal fibrosis. In that, you have proteinuria, hypertension, renal failure. In skin fibrosis, you have the tight skin, mask-like facies, and the Raynaud's phenomena. And in Raynaud's phenomena, you will be having something called as your fingers will become what? When there is excessive of cold, when there is a excessive of cold exposure, your finger will become what? Blue or red? Tell me in the comment section. Investigations. What is the investigation you will do? Histopathology is the gold standard. There you will be able to see dense collagen deposition of fibroblast and tissue distortion will be there. When you will do the imaging, you will be able to appreciate the HRCT of the chest will have the reticular opacity and a very famous honey comb-like structure in pulmonary fibrosis. Okay, in pulmonary fibrosis. What is the treatment you will do? First thing, you will give the antifibrotic therapy. That is, you will give the pirfenidone that inhibits the TGF-β, reduces the collagen synthesis. Second, you will give this thing. This is nothing but the tyrosine kinase inhibitor. Then you will give the immunosuppressants like the corticosteroids, methotrexate, okay, and the cyclophosphamide. What are the complications that can occur? What are the complications? What are the complications that can occur? The complication that can occur, there will be organ failure, there will be respiratory failure, there will be pulmonary hypertension in lung fibrosis, portal hypertension in liver, pulmonary in lungs, portal in liver. Increased risk of carcinoma in the hepatocellular carcinoma. What is the prognosis? Prognosis is it is a very poor disease and it is irreversible. Depends on the organ that are involved. In cirrhosis, you have something called as the 𝗖𝗵𝗵𝗺 score, and for the children, we use the MELD score that we will see. Okay. Then this is your basically the summary table. The central mediators of fibrosis are TGF-β. Idiopathic pulmonary fibrosis have a honeycomb-like lungs. Then in the cirrhosis, you need to remember about the bridging fibrosis with regenerative nodules are there. In scleroderma, you have the anti-centromere antibodies, and in the antifibrotic drugs, remember about the pirfenidone and nintedanib. Okay, so these are the things that you need to know. In the fibrosing disease, it's not that important topic. It will be asked as a very short note. So if you are having any sort of doubt, please feel free to reach me. Please feel free to DM me. Thank you so much.